Hello, good morning, everyone. I'm going to give folks some about 30 seconds to pop over from the waiting room here. Thank you so much for joining us. Just give everyone a second or two to queue up. Alrighty. Well, thank you everyone for joining us this morning. As you know, last month, the Trump administration announced their plans to ban access to abortion for veterans nationwide by overturning a Biden-era policy that protected access to abortion for veterans across the country and allowed providers to offer abortion services in limited circumstances. If the Trump administration is successful, millions of people across the country, including veterans and their family members, could lose access to care. Importantly, the Trump administration's proposed ban for veterans would not include access to care in cases of rape, incest, or health emergencies. Today, we are joined by an incredible panel of veterans and advocates who can talk more about what is really at stake as the Trump administration moves to ban abortion nationwide. I'm so pleased and so thrilled to be joined by a wonderful group of folks here, and I will not take too much more time. I'm going to introduce Congresswoman Chrissy Houlahan. Thank you so much, Congresswoman.
Thank you. And it's lovely to be with you. I wish we didn't have to have this conversation. It's under very unfortunate circumstances that I have the opportunity to speak with you today. Time and again, as you mentioned, since January 20th, that inauspicious day, my fellow veterans and I have come together with one singular purpose, which is to call out the Trump administration and their monstrous treatment of both active duty service members and, of course, our nation's veterans, which is what we're talking about today. From things like the firings of eminently qualified women in senior military leadership to the whitewashing of the history of Black and Brown people, from vilifying trans service members to eviscerating staffing and services at all of our VA clinics, there really seems to be no end to the harm that this administration intends to do to the people who currently serve in uniform and to those who came before them. So I'm saddened, of course, but sadly really not surprised to be called upon again as the ranking member of the Military Personnel Committee to demand that President Trump, Secretary Hegseth, and Secretary Collins cease their campaigns against our service members, against our veterans, and against women in particular. These three men and those who work under them should have no say in the medical decisions and treatments that are sought by these women, nor where they get their medical care from. On August 1st, President Trump announced a rule to rescind all abortion access, including in the case of rape, incest, or life of the mother for veterans and their families. And I'll repeat that, a rescission of the right to an abortion access in the case of rape, in the case of incest, or life of the mother for veterans and for their families. The removal of the rape exception is particularly striking given the high rates of sexual violence that are committed against women in the military. Indeed, 1 in 3 women veterans have reported experiencing some sort of sexual trauma, including sexual assault, during their service. The proposed ban would also impact the 700,000 family members of veterans who are eligible for care through the VA as well. And to make matters worse, this rulemaking places veterans and their families in a more dangerous and less equitable situation than active duty service members are placed in. Section 1093 of Title 10 ensures that TRICARE provides safeguards in the case of rape, incest, or the life of a mother in the case of active duty members. This policy at the VA does not. So why should someone who has served not be eligible for the same benefits as their active duty counterparts are? The Trump administration is politicizing medical decisions that should be strictly personal and between a woman and her doctor, all to score cheap political points and all to hurt the health of women. This is not only dangerous, but it flies in the face of the promises that we make to care for those people who take the oath and to protect this nation. They do and we do deserve better, far better. So at this point, I have the opportunity to turn this conversation over to a fellow Air Force veteran with direct experience to tell us her story. It is an honor to introduce Sylvia Anders. Sylvia is a first-generation Mexican immigrant who had an abortion in 1978 while on active duty. She had to turn to a private clinic after her care was denied, and she suffered the indignities and medical issues as a result. After leaving the service, Sylvia got her nursing license and she spent years working in VA hospitals. So she has a really unique and powerful voice in this conversation. Sylvia, it's my privilege to turn the microphone over to you to tell us more and to tell us your story.
Thank you very much. I appreciate the kind introduction, and I really appreciate all the work that you have to do in Congress for us. And I know you will keep fighting for us. I sometimes forget that I was a little brown girl running around barefoot in East Texas, climbing trees, completely unaware of the racism and misogyny that was all around me, but knowing as a child that something wasn't quite right. And as I got older, I realized what that was. So my only choice, I felt at that time, was to join the military to get veterans, VA benefits, actually education benefits. I'm sorry. But it was an escape for me, and it's an escape and an opportunity to better yourself for a lot of men and women in this country. We we serve our country. We swear on the oath of the Constitution to defend. And when I did that at 18 years old, I had a realization that this was serious stuff. This was important, and this was serious. And I had to go back and realize that the women that fought for our rights in the 60s, they had made the sacrifice, and I had to make that sacrifice too. And so in the 70s, we had to stand up, and I was one of the first women to run the obstacle course in 1974. We had to run it in a cotton blouse and gabardine slacks, while the guys were in combat boots and fatigues. But we did it. And when I finished basic training, I really felt that I had done something really transformative, and I thought, this is really going to make me a real American, and I'm going to be a real veteran, real service. I'm going to be serving my country. I spent 4 years working in a job that had never been done by women before. It was a hard job, but I did it. And then as I was getting ready to finish my service after 4 years, I was in transition. Transition for women veterans and all veterans is difficult. I had a husband that had been transferred already, and so I didn't have any place to live. I was living out of my car and on my friends' sofas. And all of a sudden, just weeks before I was ready to discharge, I realized I was pregnant. The woman that took care of me at the hospital said, "Don't worry, we can take care of this. You will be all right." I just kept telling her, "I can't do this right now. I'm trying to study for my nursing license. I'm trying to make sure I have a job when I get out. It's the worst time possible." But I had to do it, and I did it, and I moved on. And I had a son later. And then 15 years after that, as a military spouse, I had a failure to thrive pregnancy where I had to wait until I started bleeding. At that time, it was stressful, but I knew that I didn't have to worry about dying for lack of medical care. I spent about 20 years working in VA hospitals, transferring from one VA to the other because I had veteran privileges and I could transfer easily while my ex-husband was on active duty. We always took care of our patients. We were terribly understaffed, but I felt like I had a duty to continue to serve. Um, I'm still talking about the fact that I cannot believe that we fought so hard for our rights, and we fought so hard to prove that we were able to do these things. And at the end, we still have obstacles. Like, we are the first ones to have to take and face the realities that women are under attack. Women have to be Veteran women are the first women that are seeing the changes that are going to be made to this by this administration, which are devastating. And as a military spouse, as an active duty, women nowadays are in danger, and I'm really quite concerned. My A perfect example of this is My daughter, who is, in her 20s, is refusing to have children right now. She's scared. She's scared. She goes, I don't want to worry about dying just because I want to have a baby. I, I'm overwhelmed sometimes, and I just keep remembering that as a woman veteran, we still have to stand up and fight against these draconian wishes to turn us back to the 50s. And believe me, it wasn't that much fun back then for women. And at the end of that, I'm really honored to introduce Congressman Brownley. And I want to thank you also for being here. Thank you very much.
Thank you, Sylvia. I really appreciate and thank you for your service to our country, and especially now for your tireless advocacy for our fellow women veterans. We appreciate it very, very much. And thank you for sharing your story. I know it takes a lot of courage to do that, and I am and we are very, very grateful to you.
Thank you so much.
You're welcome. So as women continue to comprise the fastest growing cohort and the most diverse group in our military and veteran community, it is more important than ever to ensure that their rights and access to comprehensive care are protected, and that these rights are codified and protected by the law. Healthcare is the promise our nation has made to all veterans, and it is one we must keep. Any attempt to gut VA's reproductive health services is not just wrong, it's a direct and dangerous attack on women veterans. It's an attack that puts their health, their freedom, and in some cases, their very lives at risk. Like all women, women veterans deserve access to essential reproductive health care when and where they need it. To deny them this care is simply unacceptable. We know there is already a glaring gap in care for women veterans. Much of my work on the Veteran Affairs Committee is focused on closing those gaps and making sure women receive the comprehensive care they deserve, care that is accessible and responsive to their unique needs. But this administration's cruel and reckless decision to rescind VA's already limited abortion protections is an enormous step backwards, not only in safeguarding reproductive freedom, but in our broader commitment to our women veterans who have put their lives on the line to keep us all safe and defend our freedoms. This proposed rule would reinstate VA's near total abortion ban, even in cases of rape, incest, or life-threatening complications. It would strip away care for veterans across the country, force them to go without essential health services, and even deny care to the 700,000 family members who rely on the VA. We know the consequences. Women are denied care. Doctors are afraid to act. Patients are left to suffer, and lives are put in jeopardy. After the disastrous Dobbs ruling, we've seen women denied life-saving care, left to suffer in hospital parking lots, or told to come back only once they were close to death. Under this new proposed rule, there is no clear guarantee that women veterans facing miscarriages, ectopic pregnancies, or other life-threatening complications will get the care they need. Make no mistake, Donald Trump and his extremist allies are using women veterans to advance an anti-choice, anti-woman agenda and inch us closer to a national abortion ban. This is not only egregious and wrong, it is profoundly dangerous. The irony is also so incredibly infuriating. They claim issues of reproductive health should be left to the states, yet here they are abusing federal power to impose their personal beliefs on veterans nationwide, even in states where abortion is legal. This is a direct attack on women veterans' freedom and bodily autonomy. Veterans should be able to make personal decisions about their health without interference from any politician. Their access to care should not shift with every administration. That is why I introduced the Reproductive Freedom for Veterans Act, a bill that will protect abortion access at VA once and for all, ensuring veterans are not subjected to the political whims of whoever happens to occupy the White House. Veterans fought to defend our freedoms. They should not have to fight again for their own health care and their own freedoms. But here's the truth. We can't do this alone. We must educate the American people and demand that Congress act. This is a fight we must win because the lives of women veterans depend on it. So to the women veterans speaking out, thank you, not just for your service in uniform, but for your continued service as advocates. Your voice is more powerful than ever. And I promise you, I will continue to fight by your side until reproductive freedom for veterans is not just a policy, but the law of the land. So now I have the pleasure of introducing our next speaker, Joanna Sweat. Joanna is a Marine Corps veteran who served for almost a decade and became pregnant while in service. She co-founded Arizona Vets Forward and now serves as the National Organizing Director for Common Defense. And she has been a staunch advocate for veterans since leaving the Marine Corps. Joanna, thank you for being here. Thank you for your service. The floor is yours.
Thank you, Congresswoman Brownley, and thank you for that introduction. And thank you for your tireless efforts in advocacy and for propping up legislation to protect us. And we are proud to be in this fight with you. Like the Congresswoman said, I'm JoJo Sweat. I'm a proud United States Marine Corps veteran, URA, and also a military family member as I grew up as an Air Force brat pretty much my whole life. I served this country for many years, and I continue to serve my country through advocacy. And in that advocacy, I've also advocated for VA expansion for years, since basically the day that I left the service. As an advocate, I've sat across the table from countless women veterans and military families who rely on the VA healthcare system. And I know firsthand what it means when our government makes decisions that either protect us or abandon us. When I was serving in the Marine Corps, I learned very quickly that reproductive health care isn't a someday issue. It's actually a life or death, it's mission readiness, and family security issue. I've had friends in uniform who've had to make impossible choices because they were stationed in places where abortion care was simply not accessible. Some had to travel thousands of miles, some had to delay their care, and some just had to quietly leave the service altogether. No one should have to risk their health or their career because basic health care is politicized. As a Marine on active duty, I was forced with that decision. I was already a parent of 3 children. I joined the service with a husband and child, so I was issued a family. I became pregnant for the 4th time right after 9/11 and before we were getting ready to deploy. As a struggling 2-parent household with 3 children and 1 working income, mine, we were already breaking the bank, and my career trajectory would have been impacted negatively if I would have carried that pregnancy to term. Without a ban at that time, I still had to seek abortion services off the military installation. A year later, after I came back from my deployment to Iraq, I became pregnant again, this time through an ectopic pregnancy, probably because of my exposure to a lot of toxins during my participation in the war in Iraq. And I had to have another abortion to protect my personal life. And the truth is, more than 2 million women veterans in the United States, as well as thousands of transgender men and non-binary veterans who might need abortion care or counseling or services, are going to be affected. This proposed ban would also impact 700,000 family members of veterans that are eligible for care through the VA healthcare system. This new VA abortion ruling isn't just policy on paper. It is devastating in real life. Veterans are already navigating a system that can feel impossible to even access, and now the rug is being pulled from under them. Service members in uniform don't get to choose where they're stationed, and if they're in a state with a ban, they are stuck. For veterans, the VA is their only healthcare lifeline. And to take abortion care away is to cut off their right to decide what happens in their own bodies. Every day, I hear from veterans all across the country, women, LGBTQIA plus folks, families who are deathly afraid. They're asking, will I lose control over my healthcare? Will my daughter have fewer rights than I did when I served? The fear is real. The anger is real. And the betrayal is so real. These are people, including myself, who have raised our right hand to defend this country. And now we don't have access to our own healthcare decisions, and our dignity is on the chopping block. This is so much bigger than politics. It's about whether we keep our promise to those who served. Veterans should never have to fight their own government for the right to health care. And we are not going to stand by while those rights are stripped away. And with that, I'll hand it back to Kelly with Free and Just. Thank you.
Thank you so much, JoJo, and thank you to both Congresswoman Houlahan and Brownley. We are so grateful for your continued leadership and fierce advocacy on this issue. I also want to thank everyone who is joining us on Zoom this morning. If you are watching on Zoom and you have a question for the panel, you can either raise your hand in Zoom to come off mute, or you can submit that question in writing using the chat or the Q&A function at the bottom of your screen. Again, if you have questions, please feel free to raise your hand in Zoom or submit those questions to me in writing via Zoom, and I will read them out to the panel. And I do see a question coming in. Congresswoman Brownley, we have a question coming in about access to life-saving care under the proposed ban. The Trump administration has been adamant that exceptions mean that veterans whose lives are at risk will still be able to access abortion care, but you made clear in your remarks that there is no guarantee. Can you share a bit more about your concern there?
Yes, absolutely. So, yeah, they're saying the life, if the woman's life is in risk, they would still have access to abortion. But that's, so there's abortion bans across the country, as we know. And so one has to determine, if that patient is near death, to be able to discern whether she is eligible for an abortion or not. And that's why I said in my opening comments, sometimes women are waiting out in the parking lot ready to pass away, honestly, and they're not getting the health care they deserve. So to say we're going to still save lives from abortion is it's just not true. It sounds good. Politically, it sounds good, but the reality is it's just not the case.
I would add that you also have the chilling effect that doctors have with making that choice of what is life-threatening, what is not life-threatening, with kind of threats on them of making the wrong choice, so to speak. I think it makes it very, very hard for doctors to make those sorts of really important and impactful decisions. And so kind of regardless of what the lip service is that we're giving to this, the reality is that even now there's been enough cases where people are not having access to care because of the concern of the doctor.
Whoops.
You're on mute, Kelly.
Thank you. Wow. Very 2020 mistake on my part. Thank you both for those responses and thank you for that question. I was saying that I see a follow-up coming in, Congresswoman Houlahan, wondering if you can respond to some of the characterizations of this proposed ban as a national abortion ban. It was in The Intercept described as the first sort of test of a national abortion ban. And we have a question asking if you can describe a bit about how veterans in states where abortion is protected at the state level would be affected by this rule.
Sure, and this is kind of one of those hypotheses which I am a supporter of, which is that this is the beginning of the slippery slope that does exactly what Congresswoman Brownley was talking about, which is take something that purportedly is at the state level for decisions at this point in time, but really make it a federal, issue. And the way to start that slippery slope is to start with our veterans or start with our active duty members, and you've been seeing that happening over the course of the early months of this administration. And so, yes, I do believe this is part of a larger, plan to try to restrict access to care for women and families to these life-saving and important decisions. And I think that one of the other things we all know about the military is that we've always led, right? We've always led in terms of the changes to society that we want to see. We want to see a diverse military that represents all of us as Americans. And the military is led on integration. The military is led on women's issues and making sure that women are included in service. And what I don't want to see is the military leading on this. I want to make sure that we are leading in making progress rather than stepping back in time.
I will also add too that, and Chrissy, correct me if I'm wrong, but I believe this to be true, is still within the DoD, a woman in service still has access to an abortion in the cases of rape, incest, and the life of the mother.
I believe that to be true at this point in time. Yes, that doesn't mean that they have access at medical facilities that are military run or operated, but it does mean that they still theoretically have that access.
And that's true because it's written in law. As far as the VA is concerned, there is no law that says you have access to abortion under these conditions. So this is where the administration has the power to change the regulations within the VA as they see fit. And so for a woman to serve in the military, leave the military, come to the VA and not have any access to her reproductive health care is absolutely outrageous. And in addition to that, a physician within the VA cannot do any kind of abortion counseling. So a woman comes into a doctor's office, she's not feeling well, she's pregnant, she's worried about her future. A physician in the VA can't talk about her future at all, can't give any advice whatsoever. That would be the regulation.
Thank you both for weighing in there, and thank you for that question. Jojo and Sylvia, I wonder if you want to respond there either about how this will affect veterans even in states where abortion is currently protected, or claims that veterans will still be able to access care if they really need it. Both of you described feeling fear in your communities and uncertainty, and so I'm wondering if you want to respond there.
Yeah, we've already seen how these cuts are affecting us as veteran users of the healthcare system. I have lived in Arizona since I exited the United States Marine Corps in 2007. And a lot of people might not remember this if they weren't a part of that community. But from about 2007 to about 2010, it was a very bad system. It had not been invested in. And in fact, it was very much static. And a lot of us fought to change that, including women veterans, because there wasn't even women's clinics at the time within the veteran healthcare complex, which made going to the VA a very ostracizing experience for any women veteran. And in the last 20 years, we've done amazing things within the VA hospital system, that I had a separate facility within the VA hospital that was safe for me. I was seeing women providers, many of them who were also service women who had transitioned into the health corps. And so I felt safer. I didn't feel that, I had to answer a lot of unnecessary questions as a woman veteran. And now, since the new administration has taken over, that staff is depleted. My appointments are no longer just within that facility for women's healthcare. I've been all over the hospital now, and there are men within that facility now on a regular basis because they're shuffling everyone around and there's no space for any kind of special community or privacy. And then on top of that, the trauma of healthcare providers that are within the system, right, that may agree with these particular policies based on their religion things, are now more open in being vile on the job related to people who are not like them. A recent experience I had in going to a regular appointment and being called in with a group of veterans to then go into a room altogether to be triaged, right? A young man that worked for the hospital told another man that he couldn't open the door for me because he wouldn't know if I was a woman or not, and that you can't make any assumptions to open the door for anybody on that guidance, right? And this is somebody who works at the VA hospital, who is like openly saying these things out loud, which makes it a very uncomfortable experience for anybody who's there that might identify in ways that are different. And that has never happened to me before. The other thing that's happening are they're asking questions that are not relevant to the appointment that I'm at, like who my partner is, what sex they are, and things that are just not relevant to the care that I'm getting. And so it's becoming very invasive and then also disconnected. So we're seeing it in real time.
Sylvia, do you want to weigh in there about the fear that folks in your community are experiencing?
Well, I think women we're on a different plane as far as fear because we never know what's going to come next. And when I worked in the VA at that time, there weren't very many women veterans that were showing up for care. So they didn't really know what to do with us. At the time, I remember I had a very seminal experience with a woman veteran who was a POW from Bataan Death March. She was a woman, she was a nurse, and I was so honored to take care of her, to do anything I could for her. And I said to her, "Ma'am, what can I do for you?" And how terrible your experience was, and this is the way women react. She said, "It was bad, but I didn't feel the ones that really suffered were the children that were interred with us." She spent the entire World War II as a prisoner, and she was talking about the children were the ones that were going to have to suffer. So this is what women do when they're in the service. They bring a different point of view and they have different, feelings about what should be done and doing the right thing. So we make a lot of sacrifices, and I think that they don't understand. They don't understand the sacrifices women make to do these jobs.
Yeah, Kelly, can I just add something to what Joanna said? So I just, the VA has already cut 12,000 employees across the VA, and their goal is to cut 30,000 by the end of the fiscal year. So this issue of the women's clinics that are in hospitals across the country, I'll take some credit for that because it was a bill that I carried that is now requiring that of every medical center. But we don't have control, Congress doesn't have control over the number of people who work there, but the medical centers have their own autonomy around that. And so this is what they're doing, is that they're removing people so that you can't have access whether you have your own facility or not. It's in law to have the facility, but if you don't have the people there, the physicians there, obviously you're not going to get your health care.
Yes, thank you. Thank you so much, Congresswoman Brownley, for adding that. And thank you for continuing to lead here. I want to thank everyone who has joined us on Zoom this morning, both Congresswomen Sylvia, Joanna. I can't tell you how important and meaningful your stories are here and your continued leadership and advocacy on this issue. If folks on Zoom have follow-up questions, you can reach out to me at Kelly at Free and Just, and I will help facilitate any follow-up. Again, thank you so much to everyone who is joining us this morning, and enjoy the rest of your Wednesday. Thank you, everyone. Bye-bye.